Hey runners, are you getting tired of getting running related injuries, such as shin splints, overuse injuries, runner's knees, and so on? You know, it sucks. And so today we are speaking about running related injuries with Eric from Arc Running, and he will help you to navigate the realm of pain. So we talked about pain today. We talked about these frequent injuries such as runner's knees, about shin splints, how to treat them, and more importantly, how to prevent them. We also talked about the intricacies of runners' mindset that lead runners to develop these injuries. So you will also learn about things such as when you can listen to pain and when you can maybe run or finish your race with some pain experience.
Hello friends, if you are joining me for the first time, welcome. I'm your host Daniel Weiss, a certified nutrition coach, educator and hybrid athlete. I've created this show to help you understand and simplify nutrition so you can focus on making educated choices and improve your health, feel energetic or look like an athlete. I've been working with people who simply want to look or feel better, with athletes wanting to challenge themselves, but also with fitness professionals. I know that becoming a better, fitter version of yourself will not be possible without the right mindset and habits. And that is why I cover these topics in this podcast. I would also like to bring to your attention the nutrition guides, meal plans, and other resources that I've created over the years, and you can get them free at danweiss.eu/guides. That is danweiss.eu/guide. The link is in the description.
Can you tell us a little bit about us? What's your professional background? What led you to what you are doing right now?
Absolutely. We can start there. Thank you, Daniel. My name's Eric. I'm a physical therapist out in California, and we have a company called Arc Running that caters towards running injuries. And specifically, we saw patterns in injuries, and we're like, why not address it at a more, efficient way? Our current healthcare system in America is pretty inefficient. We have to go to the doctor first, get a script to go see a physical therapist, and just waste time and money. So we decided to capture the patterns we see in running injuries to help the runner understand it a bit more and also treat themselves, and we can guide them along the way. But that's kind of the basis of our company.
And we will definitely talk more about this, but you created this company to help runners to treat injuries. But as a physiotherapist, you also know that there is rehabilitation, but also prehabilitation process. And why do even runners get injured in the first place? Because based on my knowledge, runners are the most injured active people, by far, from any kind of sport.
Yeah, that is a great question. Is so many different components to what causes runners pain, but I'll kind of give the most predominant features we see. And you're right. That's why we picked runners, because there are so many running injuries we see. It's like, let's help this population first. So, generally blanket statement, running injuries, a lot of it has to do with just training error. They go too hard, too soon, too fast, especially beginning runners, that contribute to just overuse of the tissue. So that's one of the main components, but other factors that include strength issues like weakness in, say, the quads or the calf, running form. Sometimes they, doing heel striking is more ground reaction forces causing more impact on the body, and even not recovering, say, from past injuries and stuff like that, which could affect the running potential there. So again, there's a big multitude of contributing factors, but those are kind of the main ones that I see. And I'll be happy to dive in more specifically if you want to go into those general topics.
Yeah, definitely. So I know that there are specific injuries that are more frequent than the others. So what do you see the most frequent injuries to be?
Yeah. So the most common, probably about 50% of running injuries is actually 48%, but 50% is the knee, and specifically it's runner's knee. That's why that's why it's so common. It's called runner's knee. And so let's talk about that injury, for example. I see it a lot in the clinic, and runner's knee is essentially an overload issue of the kneecap. And again, there are contributing factors, but essentially each tissue has a certain amount of load it can tolerate. So if it's over compressed, over stretched, or over shear, can cause some issues. So specifically for runner's knee, we see for this one, usually it's, again, back to training error. A lot of people want to go start running or pick up the mileage, and they go too hard, too fast, too soon. So the tissue's ability to recover isn't great, and they kind of keep pushing this tissue beyond its limit. When I say tissue, it's actually the kneecap, and specifically the cartilage behind the kneecap gets overloaded. Cartilage, which is a relatively avascular structure behind the kneecap, has a slow recovery time because of the lack of blood flow. So if you have like a muscle strain, you recover pretty quick. If you have a kneecap issue, it just takes a little bit of appreciation to understand the healing process and take some time. So with training errors like runner's knee, usually they don't see issues until 3 to 4 weeks after the training error occurred. So it kind of comes out of nowhere for them. So for example, for runners with runner's knee, I say, hey, what are you coming in for? Knee pain. I talk about their training program, and they're usually like, oh yeah, I changed my mileage about a month ago. I started to increase my intensity or increase my mileage. And that was, oh yeah, that you had to do a little more gradual. But it's tricky because you don't see it until a month later. So to answer your question, yeah, runner's knee is the most common issue, and it's the usually the training error. But if I can throw in a couple of things here too, other contributing factors for runner's knee is weak hips. If you have a weakness in the hips, and a lot of runners hate strength training, it's just something else to do, but it really doesn't have to be that many exercises. But with weaker hips, your knee tends to collapse a little bit and cause a shearing force on the kneecap. So we see a lot of runners, when they take a step, the knee collapses in, and that could be indicative potentially of weak hips causing strain at the knee. Weaker quadriceps can help offload the pressure from the kneecap, and even ankle mobility. If your ankle mobility isn't great, into dorsiflexion, meaning kind of bending your foot coming up, that's called dorsiflexion. If that range of motion is great, you will compensate by caving your knee in as well. So again, it's a lot of maybe contributing factors, but from my experience, usually about 60-70% is related to training error.
Right, and specifically with the runner's knee, what I know is that the most common issue is, like you said, the hip and the ankle. And as I understand it, the knee is like the victim of these issues that are either below it or above it.
Exactly. Actually, it's well put, Daniel. And I couldn't have said better myself. Usually I tell them it's usually not the issue at the knee per se. Again, going back to the ankle or hip. I do want to touch a quick point on pain itself for your audience. Pain is a fun little thing. Pain is there to protect you. So you have to listen to the pain. The pain is telling the story of what's going on at a tissue. It's being overloaded. So you have to listen to that and understand. Just because you have pain doesn't necessarily mean you have high tissue damage. And a good analogy is if you put your hand over a fire, you have pain, you take it away, it's gone. There's no tissue damage, but you had pain. So you got to think of pain as a good thing, actually, because it's telling you something isn't quite right. And now there are some people that don't experience pain. It's called congenital insensitive to pain, pretty much. So it sounds cool that you don't feel pain, but the issue with that is they can break down tissue without even knowing it. And it's actually fatal because it could have an infection and not even know it. So, sorry, a slight tangent there, but for runner's knee, the pain is just telling a story, what's going on maybe at the hip, the ankle, or the lack of strength or training error. So you should really investigate as to why.
And this is actually good way how you addressed it. And there is one thing that comes to my mind when we talk about pain. And that is also that runners, like especially those endurance athletes, one thing like psychological adaptation to endurance running is ignoring pain. And this helps you to go over the long run, to conquer your marathon or whatever kind of training. On the flip side, this can be a problem when you are ignoring the pain that you feel, and that can lead you down to even worse issues.
That is, actually, thanks for bringing that up too, because I have a lot to say on that. I always joke with runners because they tend to be a stubborn population. They don't want to stop running, and I get that. Because maybe you have a race coming up or a training program you're really following, and you think that you get weaker if you stop training. And the reality is it's not true. In a case example, I had trained a client recently who was training for Boston. Actually, I'm sorry, I didn't train them, but they reached out to me 6 weeks prior to Boston. They had shin splints or symptoms of, and they had questions. Should I keep going? What's going on? And given that it was 6 weeks away and shin splints can be stubborn, we said, hey, shut it down for 2 weeks. You can bike, you can do strength training, but just don't run for 2 weeks. He hated to hear that, but he did listen to that. And then he was able to run the Boston Marathon pain-free. Actually got a PR. And so I tell all my runners, like, pain does suck, but training, addressing the pain is over. You want that over the training program. Okay, so that's priority. Because it will not get better, and you'll see like more issues if you don't address that, because you could compensate in running form, or the pain will just simply get worse. And I tell my runners, like, hey, we may not hit the exact training program, but I don't want you to limp to the start line. So at least let's get you pain free to the start line, and hope for the best for the run itself. And again, usually they do really well. It's just a psychological thing that if we skip training, that our running program is done. But that's not true at all. And know that your body will appreciate that if you address the pain.
Well, thank you for sharing this story with us, because it was definitely my case. And I had several of these running injuries, and I think because I was ignoring it, I was not resting it enough, and then like not going through rehabilitation process, it extended maybe from 2 weeks to 6-7 months. And like you said, we are stubborn. We think that we are losing fitness. Yeah. And I think that this is important, what you mentioned. This client of yours, he not only got better and not lost fitness, but probably even did him even better to rest it because he got his PR. So that's amazing.
Mm-hmm. Oh, yeah. Oh, no. Yeah, it's great. So I want the runners to really hit that in their head. Please know that it's okay to adjust the training schedule. Enjoy the run at the very least. Get pain-free, So thank you, Daniel. And like you said, we're all stubborn human beings, and we try to ignore it. But I guess maybe a thing is if you could, it's okay sometimes to run with pain, and we can address that in a moment. So I can tell you when to do it and when to not. But if the pain doesn't really go away in like a week or two, you might want to think about it and readdress your schedule until the pain is addressed.
Yeah, so just maybe let me share you my story. What was the worst injury that I had, and it was I went running and I had some pain in my feet. And it was around metatarsals, so around fingers, something like that. And I ignored it for a week. And then one day I went for a lunch ride, lunch run. I went there after 5 kilometers, sharp pain, couldn't go home. I limped back home 5 kilometers. And that was that for 6-7 months injury. It was not broken, fortunately.
Yeah,
but
brutal.
but it was like stress fracture, not completely broken, but there was a stress fracture. So yeah, let's not ignore pain.
Can I ask a question about that?
Sure.
Yeah. Was that an overuse? Was that an overuse issue with your metatarsal stress fracture? Because usually stress fractures, I hear overload or overuse.
They're overuse.
Yeah. And why was that? Were you doing like a training? Was it a little? Okay. Yeah. Got it. Yeah. So listen to that pain, everyone. It's well.
And like you said, I increased my training like too fast, too much, too soon, too fast. And yeah, I mean, I was not a new runner. This was after years of running, and I just basically went on a half marathon training, not even full marathon training, but maybe from running 30 miles a week, I jumped to 60. So double the distance suddenly. There it was.
Yeah, it's like that's a good way to hurt yourself. Yeah. Thank you for being the example of how to, hurt yourself so we can learn from that, Daniel. You're very, very good human being to help us learn.
So. Yeah, there are people who like to hurt themselves.
That's a big jump.
For the others.
It's a very big.
Okay, so
for science gains, I appreciate that.
So what are maybe some other frequent injuries? You already mentioned shin splints. Yeah.
Yes, I guess so. So other common ones, and actually, I don't want to forget this topic too. We'll circle back with like when should we ignore it, or when should we run into the pain? And I'll talk about that after these injuries. Another very common one. Okay, so we got knee pain. Actually, Achilles tendonitis is probably the second most common. I think it's about, if I'm not mistaken, 10 to 15% of running injuries is Achilles issues. Okay. So it's called Achilles tendonitis or tendinosis. Achilles is a tendon behind the heel. If you just Google Achilles, you can see it. But it's a very it's the calf attaches to Achilles, attaches to the heel, and it can really take on a lot of loads running. So that's another common issue we see is Achilles tendonitis or tendinosis. Let me explain about tendonitis versus tendinosis first, and then we'll go through questions. Achilles tendonitis is an acute inflammatory condition. So tendonitis, the itis means inflammation. So it's an acute inflammatory condition. So for example, if I was crazy and did say 30 miles to 60 miles in 1 week, you might get an issue with the Achilles tendon. It might be sore to walk and progressively get worse there. So it's usually a swelling, a redness, a higher pain issue. And that can resolve itself relatively quickly. Tendinosis is a chronic issue, meaning that if you had pain for a few months and there's not a lot of swelling in the tendon, it's a chronic degeneration of the tissue. The best way I describe it to my clients is the tissue didn't heal properly. So usually the body does a good job healing, but sometimes it can be stubborn too, like anything in life. And the tissue is built up not in the strongest fashion. So Achilles tendinosis, it's more of a nodule you might feel on the Achilles tendon. It's a hardness, not a softness like a tendonitis. And it could be sensitive to touch. And how you treat that is actually through loading the tissue. But we can talk about that treatment later. But that's, again, another common issue is Achilles tendonitis and tendinosis in runners.
I have a friend actually who is competing at a very high level. And he has probably Achilles tendinosis because it's like reoccurring, and you can see a kind of bump behind his heel, nodule. Right? So it's like probably going into like bone spur. Yeah. Correct me if I'm wrong. And I've seen this like many times, and the reason I'm also mentioning this is because this is something you started talking about, like differences in how it heals, and that the tissue, basically the way how it heals, how you can get out of that injury can be a very tricky process, especially if it's like reoccurring thing, a chronic thing.
Yeah, actually, kind of funny story how they found out the treatment of this. There's a guy, Alfredson. He's actually out in Europe, so closer to you. He was a doctor and he was a runner and had issues with his Achilles tendon. This was like I think the early 90s. I could be wrong. But I mean, I'm not sure if it was an urban legend or what, but apparently the story goes is he went to a doctor. He's like, hey, can you help do surgery on my Achilles tendon? It's painful. I don't know what else to do. And the doctor's like, well, I'm not going to repair it if it's not torn completely. So he was so frustrated, he was actually literally trying to tear his Achilles tendon by loading it. So he increased the load on it. What he found out actually about this is as he was trying to tear it, he actually started to feel better because he was loading the tissue and it was getting stronger. So based upon this kind of moment for him, he's like, oh crap, like I'm actually feeling good. And so that his situation led him to doing a lifelong, pretty much his research devoted to eccentric training on tendinopathies. So when I say tendinopathy, Achilles tendon, it's a tendon, so it's a tendinopathy or degeneration of the tissue. So with these Achilles chronic issues, where in the itis usually kind of rest it and let it chill out for recovery. Tendinosis is you load it. You go into slight discomfort to load it with heel raises, usually 3 sets of 12, slowly, and the tissues begin to respond. So you got two different treatments depending on how it presents. And sometimes it could be a hybrid of of both of them at the same time. In some capacity, it could be a little tricky. But generally speaking, whatever the predominant issue is, you address it that way. So for your friend, I would say, hey, you should do single leg heel raises into some pain, 3 sets of 12 most days of the week. Again, there's different protocols a little bit, but it's essentially higher volume load, and it should respond in a few weeks. So just kind of a little segue there, but it's intriguing how that got brought up of how to treat it.
Yeah, sure. The problem is often with those competitive athletes that, for example, now there is season. Not everyone wants to break their season. And we are back to that stubbornness and kind of things. I'm not saying that this is his case, just bringing that up. Okay, so you started talking about pain.
Sure, too. And again,
so let us get back to the pain, like when to ignore it, when to listen to it, or how to interpret it. Then maybe let's talk about how to get out of these injuries, like a rehabilitation process.
Yes. Yeah, let me start with pain, because pain is a loaded topic, and there's been excellent research done especially out of Australia. Mosley and Butler are some leading therapists in the pain science world, and I had the fortunate opportunity to take a course with them. So let's talk about pain. I'll start with the best way to describe it as a concept in itself, with a story. There was I think this was in London, in the 1995 British Medical Journal. This construction worker was walking around, had a boot on, and he stepped on a nail. And he saw the nail went right through his boot. So he's like, crap, it went through my foot. So he was in a lot of pain, excruciating pain. And so they lifted him in. He was screaming. He went to the emergency room. And it took a while to get the boot off because he was just in a lot of pain. And when they got the boot off, they realized the nail went between the toes. And so it didn't even pierce the skin. There's no tissue damage, nothing. But he perceived a situation with, that's through my foot, therefore I'm in pain. So pain is super interesting. Pain can be there even if you don't have like tissue damage. And there's a big emotional component. Now, I know today's topic doesn't necessarily talk about the in-depth pain science, but just know that there's an emotional component to pain. So pain can be influenced by a lot of factors, such as context, if you're really stressed about it, stuff like that. So for example, I'm a physical therapist. I see pain all day long. And if I get injured, I'm not stressed about it because I kind of know what to do. But if someone doesn't know anything about pain, they get really stressed about it. And so their pain experience might be higher than mine because the anxiety and the stress causes the brain to have this experience like, wow, like, I'm dying here situation. So again, pain's there to protect, but maybe the alarm system's just ringing way too high. So I just want to put that in there. It's a much more involved topic. But with tissue injury or strain on the tissue, the question is, okay, how do we deal with this? Like, do we run? Do we rest? Stuff like that. So I'm going to give the audience general advice. If the pain is on a pain rating scale, we rate it from 10 being a lot of pain. I say go into the ER, which is really sharp shooting pain, and 0, no pain at all. Generally speaking, I say, hey, you can still run if the pain is less than 3 out of 10. The pain does not linger afterwards, like after the run, or they're not there the next day. So that's 3 criteria I use if you should take off running or not. And again, it's a little balanced depending on the injury, depending on the person, stuff like that. If it's above a 4 out of 10 and it's a little bit more sharper, it lingers a little bit more, that's just saying it's not quite ready to load it. Okay. So that's kind of a general rule that I use with my clients about if you should run with pain or not. Now, with pain, depending on the area and stuff like that, I might have them on a walk-run program first, just to get some load still. They can still run and maybe change the surface, like a trail or a track, which is more shock absorbing than concrete. So the different influences or factors, or even a treadmill, maybe an incline is less impactful than going like downhill or, concrete. So again, there's influences of how you can adjust your running a little bit if you still want to run and you meet the criteria of the pain, that I said, less than 3 out of 10, doesn't linger, not there the next day. Did that answer your question there? Making sure it's going through.
Yeah. I think this is a pretty good explanation. So now, let's say that we have a runner who is starting to feel pain, for example, shin or wherever that is, or Achilles tendon or wherever. And let's say it's like 3 out of 10 or 4 out of 10. So he wants to catch it before it develops into something more problematic. So what should he do? You mentioned that probably he can still run. He can change the surface.
A great question. That's a wonderful question. So again, I kind of give you a blanket statement. It depends on the person, the program, the type of injury. But if I feel uneasy, for example, I feel like this is probably going to get worse if it continues, then I'll shut it down a little bit more. And again, some people might have mild aches. Like I have sometimes a mild Achilles issue from time to time, and I'm okay because I'm comfortable knowing that's going to be okay and stuff like that. So, general rule, I hope I answer this the way that I perceive it. If they come to me and they say, Eric, I have running pain right now, what should I do? I'll say, okay, how high is the pain? What's going on? And if it falls within my parameters, I say, we can go a little bit longer. Let me make some adjustments. Maybe we can adjust running form, mileage, stuff like that. I do want the pain to go away because ideally, running is a huge stress release for people. It offers a lot of benefits. So I don't necessarily want them to shut it down completely if they don't have to. We can make adjustments first. But after a couple weeks, if this pain is still kind of stubborn, it's not getting better, then I might shut it down for a week or two, depending on the extent of the injury. And I know it's a general statement because there's a lot of personal factors that might influence the decision to shut it down, modify, or not. For example, if it's more of an acute issue, I would probably be more prone to shut it down just to get rid of the pain. If they've had this long-standing problem for years, I might be more inclined to run a little bit, but maybe change the form a little bit, change the surface, help them with their exercise routine, stuff like that. So again, there's a lot of variables with this question. It's a fantastic question. It's, as you can tell, it's kind of gray depending on the issue, the person, and all that. But did I answer that question for that appropriately, or do you want me to expand off that?
I think that giving people some guideline, some estimation is really great. And probably giving black or white answers to me is like a red flag, right?
And true. And so I'll put this, and also depends with the race coming up or not too. Generally speaking, it depends how far out they are from the race, because I don't want the pain to linger. So if they're not training for a race, I'm a little more comfortable with experimenting, or maybe, let's try this or whatever. If a race is coming up, then I tend to be more conservative because I don't want to guess and then the pain still is there. Then we have to shut it down anyhow. So I tend to be more prone to slightly shut it down before a race, depending how far it is, just to avoid the risk of increasing the pain too.
That's an excellent point, because I see this in running communities very often. People ask, like, I have a race in 2 weeks, I still need to do my longest long run or whatever, but I feel that pain. Like, should I do it or should I not do it? And they are thinking that by missing that, let's say, last week, after months of training, in ideal circumstances, that they will lose all their fitness. But the bigger risk is that you will injure yourself and not get into the race in the first place.
100%. It's an interesting mindset. And it makes sense talking it out loud, but when you're in it, I get it as a runner. You're like, no, don't want to mess the training up. But again,
Yeah, totally.
pain over the program first. Address and go back to the program.
And that is why what I would argue, like, go to professional, because he has an outside perspective. You are in the pain, you are in the problem. In the problem, you will not find your solution, because your mind will be playing with you. And this happens to all of us. Like you said, it happened to me. I know that I should not, but I'm doing it.
We say everyone else can listen to it but us, right? But you're absolutely right with the third perspective, because depending on that, hopefully it's a good professional too. They can ask the right questions, guiding you with thoughts. And there's a lot of things about pain, by the way, too. I always put like a circle, like here's your pain. It could be training program, your sleeping, your stress, your nutrition is a huge one. So a lot of factors that influence your experience of pain. Emotional health, stuff like that. So if people can get more well-rounded look about that, they can deal with it a little bit better.
Yeah, that's all interesting. So maybe I'm thinking there are many tools in the market that promise either preventing pain or dealing with pain. And there are like those massage guns, cold therapy, and all the way to supplements. So do you have any like bullshit things that people do and they invest money or spend money on?
Oh man, good question. Let me put it this way. There was a study talking about pain, and they had two groups of people. They had people that they said, hey, this is for headaches, I believe, or neck pain or whatever. One group, they said, hey, I'm going to give you this pill, and this will make your symptoms better. And the other group, they said, I'm going to give you this pill, and it may or may not work. The group that had the first group saying, hey, this will help you, I think there was a 30 or 40% they improved over the other group. And the pill was a sugar pill. It was placebo. So what they tapped into was the power of the mind, or of thinking. So to answer that question, there's a lot of different ways to skin a cat. I have my biases of how pain should be addressed. But where I work full time is we have acupuncturists that people respond much better to acu, say, than myself. We have chiropractic, we have health coaching. So a lot of different ways of how to approach that. In terms of gimmicks, I have a lot of thoughts on that. I tend to run cheap, so I don't think you need all the fancy stuff. But if it helps you, more power to you. I would be suspicious with blanket statements, like you said before, like this will cure everything. This one fix all for back pain, for example. It's not quite like that. So I would usually save you money. I don't have any fancy equipment myself. I just have my hands, my thoughts, and my exercise. And that seems to do the trick pretty well for me. But again, a Theragun, for example, is expensive, but people like it because it feels good. So I have no issues with that. Again, there are other products that aren't quite PT related, like, for example, electrocuting your body, get muscle development. I've seen that goes through cycles over and over again in terms of marketing that as a fitness thing. Well, that's one thing I don't really care much about. But for the most part, if it works for you, great. But I don't see the need to spend thousands of dollars because you have all the resources you need with you. So,
right, sure. So what are maybe some of the tools that one can use that are more reliable. And basically we can also transition to your tool, because you have created something amazing. But I will let you to tell people about it.
Yeah, for our company. Well, okay, so for the tools, we don't have. I don't again use a lot of expensive tools. Like honestly, there's the exercise ball I like and some of the bands. So those are good products to help with your exercise routine. I'm very heavy into exercise. And again, there's other things that help people. I'm not against that. I'm just saying what I use that's been working well. Generally speaking, at least in America, I'm not sure it's out for you. We tend to have the lazier population. So they try everything else but active work until they finally do the active work. They can see probably the biggest benefit. So transitioning to our company, Arc Running, we are comprised of a running coach and myself, a physical therapist. And our whole goal is to create a really solid platform about anything related to running. And what I noticed too was part of the impetus to create this is not only can we address the patterns early for people so they can avoid going to expensive clinic and stuff like that, but they can heal themselves. But they also have the ability just to connect with us along the way. So we do have a membership model that people can use. It's like $8 a month. It's not that expensive, where they can reach out at any time and we can kind of help guide them along in this process as well. I was going to say something else about our company, but I'm very proud of it because it seems to just help people a lot. So so that's our company, Arc Running, and we launched in January. Yeah, go ahead.
Like the first thing that I noticed about it is like, or what I loved about it is that it is online platform and it is very well designed to help people first identify the pain and then lead them through this rehabilitation process. And like you said, they can reach out to you. So for me, like one of the major obstacles was to actually go physically to visit a physiotherapist. And I also had a lot of negative experience with physical therapists, at least in my area. So I all the time when I had to visit, I went to a new place. And after 2 or 3 visits, we don't need to have a lot of bad experience. You just don't trust these people. So I started searching online for advice, and I actually got better advice online from Canada, from elsewhere, completely from a very far place. So your tool, I can use it, I can log in, check it, start working on it, and see if it makes a difference right away.
Yeah, appreciate that. It is tricky to find, like, again, in the US, there are good and bad physical therapists. I'm sorry you had a bad experience with that. And sadly, it's more commonplace that it's harder to find maybe high quality people because there's a lot of different reasons for that. But it's also, how do you find physical therapists that are specialized in running as well? And that's also a little bit of a niche, is like how to cater to that. So I appreciate that. Yeah, we pride ourselves, and that's what I was going to say, is there's a lot of not great advice out there. And we met through Running Group because I was answering people's questions about injuries. And we hope to just create just a quality site where they get the correct information about injuries, recovery process, and how to understand it. Because we noticed that was there's so much out there if you type in Google of what to do. And so we kind of help make it very simple. And the issue I had initially was I made so much words. I was trying to explain it so well, but it got too much. So we simplified it. Just an easy, understandable platform there. So yeah, I appreciate that. So, again, there's nothing, of course, wrong going to see physical therapists. We just hope they give you good advice. And if not, we're a good resource that could help at no risk or low risk, because only, again, $8 a month. So we feel that the value is there for that.
Yeah, and definitely I will put the link to your website and to your program down in the description so people can quickly check it. And start working on it. Maybe I have one or two more questions that I think will be valuable, because this is what some people are asking about. Like, when we talked about the tools, one of the tools is footwear, so shoes. And there are a lot of things, and especially like a lot of different shoes. Some with a lot of stability, some with I don't know, pronation, and I don't know what everything goes into these shoes. So, are there any kind of shoes that would be generally recommended, or do you have any recommendations for running shoes? Some guidelines?
Man, that is a great question. And actually, for your audience, someone came in recently about a month ago, and we have it up on our website about how to choose shoes. This is a great point you bring up, because a lot of people in running groups are like, I have an injury, let me change my running shoe. And I tell them it's probably about 5% of the issue, or 5 to 10% most. It's really not the issue that people are looking for. Now, there are little differences with like the heel, the cushion, how much support you have, stability, all those little different nuances. And that isn't how do you do it. I usually tell people what feels best for you, because everyone's so different. There was, like, say, a minimalist, where people barely had anything on there, and then people started getting a lot of injuries because everyone changed all the shoes to that. And now Hoka's, for example, they're a very cushioned shoe. I'm not sure if you know Hoka. They're out of Utah, but they're a very popular running shoe, and they offer a lot of support there. So you got a huge variation there. So I think the best resource for them is, again, they can go on our site, and there's like a video link about how to choose a shoe. But for my clients, it's usually, again, I ask them, like, what makes you feel comfortable? The little nuances of basically how the shoe bends too, how flexible that is near the toe, is one factor. But again, it's a blanket statement, but I usually don't go too much into the shoe. And usually I address the training error problem first and other things first. And if those still don't work, then we talk about changing the shoe. But if we change a lot too fast, it could change the strike pattern, the way it absorbs shock, and it just could alter things. So you get this cycle of just like continual pain because you keep changing the type of shoes because you think the shoe's a problem or it's something else. Sorry, that was a total blanket statement, but generally speaking, it's very minimal issues that I see with my runners. And I usually just bottom line is, what do you feel the most comfortable in running? Because there's so many variations out there.
So one thing that we haven't touched is like specific supplements, and I don't want to go like too deep into the supplements, but one that is specifically related to running injuries and prevention is like some kind of joint supports and specifically collagen. So do you have any thoughts on these?
Good question. My background isn't in nutrition per se. I do have a perspective on nutrition. I take personally collagen myself, and I'm not sure it's placebo or not, but I had some issues with a ligament, and the doctor recommended that, and I've been just taking it daily. And again, the evidence is mixed out there, but that helps me as a placebo at least. Mm-hmm. But in regards to nutrition, that's generally out of my realm. I mean, you're the expert, Daniel, on that much more than me, but I tell them because we refer to a health coach or a nutritionist if they need specific needs, because I don't want to mislead people with fueling and stuff like that. But it's, again, we have resources on our site that connect to nutritionists if you need that. But it's such a huge value for a runner. Nutrition is huge. And what you eat is what your body can work with. And if you're eating junk, like high sugars, high inflammatory type foods, it's just, you don't respond well, you don't heal well. So, the generic thing is a balanced diet, but with supplements, I don't really have a strong passion for one supplement over the other. People do. That's just not me. I tend to get my, and I have nothing wrong with supplements. I just try to do the best I can, just eating it organically for myself. And again, I know I didn't answer that question because that's complete background, and you are the expert there, Daniel. And so I'd love to learn more about that.
Yeah, I was curious because maybe you have experience from people who are specifically like in the realm of injury, and you can have more experience with that, like maybe they are using them on their own. Usually they do. So that's why I'm asking.
Yeah. To kind of do that, I mean, this is, not necessarily for injury recovery, not necessarily as a supplement, but I tend to bias towards more protein or type of intake. I know there's vegetarians out there, so they can get it in other capacities, but that tends, at least, correct me if I'm wrong too, but tends to help the healing process a little bit that I've understood. But again, generally speaking, you have that pain. Remember, you described in the beginning, you have that pain experience, and there's a lot of contributing factors. And if nutrition is off, you're going to take a little bit longer to heal and won't be as great. So really just pay attention to your diet for the healing process. It is a huge thing. And Daniel, we thank you for that, because you provide quality content that I see, that I like. So I appreciate that.
Okay, so thank you very much as well. So for anyone who is listening who wants to check out your products, they will find the link in the description below. Thank you once again. And before we say goodbye, is there anything that maybe we have missed that you would like to address, or do you feel like we've covered everything that you wanted to?
I think, no, I'll just sign off with I'm big into movement. So, hey, if running isn't your thing for whatever reason, I implore you to keep your body healthy, because your older self will thank your younger self for doing the hard work now. I learned this as choose your hard. It is hard to be healthy every day, making the right choice, but it's also hard to be, fat and unhealthy. So you can make the short term or the long term view of it. But get out there and move around. Your body will love it. It's not running. Please just walk, do whatever you can to keep your body healthy. And that comes from physical activity, nutrition, and mental health as well. So I'll kind of leave it a blanket like that. Yeah.
Yeah, I love that. So thank you once again, and you have a great day.
Daniel, you too. Thank you very much. Appreciate it.
I hope that you enjoyed this episode, and before you leave, it would be awesome if you could leave a rating and a review on the platform or an application that you use for listening. It will help me greatly to bring new guests and discuss topics you are interested in. By the way, check the show notes for important links, maybe that we discussed during the episode and all the other, and subscribe to Health, Energy, and Performance newsletter, where I share at least one tip about nutrition, training, and mindset that will help you reach your health and fitness goals easily.